Hello dear friends. नो सूट्स एंड इट्स peculiar नेचर के इस लाइव सेशन में आप सभी का स्वागत है. टुडे I would like to discuss very important topic, the concept of William Boericke, especially in case of treatment of tuberculosis. So first of all, Happy New Year to everyone. Hope so this year will give you more success, more achievement, especially in field of homeopathy. Today, I would like to discuss this very important topic. And this topic will be in both Hindi and English so everyone can understand the basic concept. So everyone can understand the basic concept. Few important things regarding tuberculosis. According to Dr. William Boericke, tuberculinum need more frequent repetition in children complaint than nearly every other chronic remedy. Tuberculinum को especially in case of children, बच्चों के केस में frequently repeat किया जाता है. nearly जहां पर हम दूसरी मेडिसिन को इस्तेमाल करते हैं, कम इस्तेमाल करते हैं, मगर यहां पर ट्यूबरकुलिनम को बच्चों के केस में फ्रीक्वेंटली रिपीट किया जाता है. फर्स्ट, और ये बताने वाले थे डॉक्टर फ्रेच वुड्स. 30 या उससे हायर पोटेंसी को इनफ्रीक्वेंट डोजेस में इस्तेमाल किया जाता है. और सबसे इंपॉर्टेंट बात, when tuberculinum fail, you prescribe the remedy, your well-selected remedy is failed, then syphilinum often follow advantageously, producing a reactions. Because there are lots of remedies in which there is clearly mentioned that if this remedy fail, go for this remedy. Aconite fail, go for sulfur. Sulfur fail, go for tuberculinum. Tuberculinum fail, go for syphilinum. So we have a concept. If something is failed, it means something is behind. Something is blocking the cure. So we have to understand the basic concept of miasm 2, especially in case of chronic diseases. If you are dealing with chronic diseases, if we know the miasmatic background of the patient, then we can easily understand if something is blocked, if something is failed, then what we have to do in that condition. So, in particular, in case of tuberculinum, if tuberculinum fail, you prescribe according to the symptomatology, you prescribe according to the basic concept of homeopathy. Then, if it is failed, go for the syphilinum. It will clear the block. The use of tuberculinum in Thysus pulmonalis. अगर हम लंग के ट्यूबरकुलोसिस की बात करते हैं, स्पेशली इन केस ऑफ ट्यूबरकुलिनम, तो कुछ चीजें हैं, कुछ पॉइंट्स हैं जो हमें ध्यान में रखने होंगे. वी शुड अंडरस्टैंड few particular points before prescribing this remedy. Very important. If you have pen and paper, please write it down. If you open the book, it's very good. First, in apyretic purely tubercular thysis, results are marked provided the eliminative organs are in good order, but nothing below the 1000 should be used unless absolutely necessary. अगर आप apyretic condition क्या होती है? apyretic condition होती है जहां पर फीवर नहीं है. If there is no fever, that means apyretic. If the organs are in good condition, provide the eliminating organs are in good order, but nothing below the 1000 should be used. 1 m से नीचे की पोटेंसी आपको नहीं इस्तेमाल करनी, but unless absolutely necessary. apyretic केस है, पेशेंट को अभी फीवर नहीं आ रहा, ऑर्गन बहुत अच्छी शेप में है, बहुत अच्छे रोल में है, उसके अंदर कोई ज्यादा वेयर एंड टियर नहीं हुई. Go for 1 m potency. Don't prescribe below 1 m. According to Boericke, William Boericke. और 1 m तभी दें, 1 m से नीचे तभी जाएं अगर बहुत ज्यादा जरूरी हो. फर्स्ट सबसे इंपॉर्टेंट चीज, स्पेशली डोजेस. With patient where streptococcus, staphylo or pneumococcus are in the bronchi, where also after washing the sputum a pure TB bacilli mass remain, the same treatment is indicated. अब डॉक्टर बोरिक लिखते हैं कि आपके पेशेंट में बैक्टीरियोलॉजिकल एनालिसिस करवाया आपने, उसमें स्ट्रेप्टोकोकस, स्टेफाइलोकोकस, न्यूमोकोकस, एवरीथिंग इज इन द ब्रोंकाई. और वॉशिंग द स्पूटम, आपने स्पूटम को भी वॉश किया. एक प्योर टीबी बैसिलाई मास रिमेन, उसके बाद आपने देखा कि वहां पर प्योर ट्यूबरकुलोसिस का मास रिमेन रह गया है, तो वहां पर भी आपको सेम ट्रीटमेंट से चलना है. कौन सा ट्रीटमेंट? 1 m पोटेंसी, हाई पोटेंसी. So we have to, especially in case of tuberculosis, first condition is when the person is apyretic, no fever, the organ is very good health, there is no wear and tear. Don't prescribe below 1 m unless absolutely necessary. Don't prescribe below 1 m. And in other thing, if the patient having a streptococcus, staphylococcus, pneumococci, every bacteria is present in the bronchi. Every bacteria is present in the bronchi, and even after washing the sputum, there is a pure tuberculosis bacteria is there. You will go for the same treatment. Prescribe 1 m. Don't prescribe below 1 m. First, with mixed infection. If you are dealing with mixed infection, For example, streptococcus infection, staphylococcus infection, pneumococcal infection. With mixed infection found in majority of the cases, where the sputum swarms with virulent microorganism in addition to the tuberculinum bacilli. Other procedure is necessary. अब आपके पास केस है, आपके पास मिक्स इन्फेक्शन का केस आया, मेजॉरिटी ऑफ केसेस में जो मिलता है, जो स्पूटम है पेशेंट का, उसमें ट्यूबरकुलर बैसिलाई के साथ साथ दूसरे इन्फेक्शन, दूसरे बैक्टीरियाज भी हैं. तो यहां पर आपको कुछ चीजों का, एडिशनल चीजों का इस्तेमाल करना है. एंड व्हाट दीज आर? ड्यूरिंग मिक्स इन्फेक्शंस we have to consider something else in the treatment. First, if the heart is in good shape, so especially in treatment of tuberculosis, you should always examine the heart. Lungs, heart. First, we are considering lung. The tissues are healthy, apyretic condition, 1M potency, no below 1M, until very necessary. Second thing, if you are dealing with mixed infection, everything is mixed, every bacteria is present in the bronchi, and sputum have mixed infection, then a few things is important. That is, the first condition is heart is in the good shape. If the heart is in the good shape, a single dose of tuberculinum 1M or 2M. So our problem is that if we have a 1M potency, then the next potency we have is 10M. We don't have 1M, 2M, 3M, 4M, 5M, 6M, 7M, 8M, 9M, 10M. We don't have the in-between potencies. If we have that in-between potency, we can easily manage these kind of cases because every single potency have a different effects. 30% potency has different effects, 200 has different, 1M has different, 10M have different. But if we know the in-between potency, we can experience the different way of treatment. So, if the heart is in good shape, a single dose of tuberculinum 1M or 2M is given, and provide there is no mark indications for other remedy. And you guys only prescribe tuberculinum in that condition when there is no other indication. And if you know about the basic concept of NOSORT, you can go through my recent videos regarding NOSORTs. Basic concept, when you have to select the remedy, when you have to select the NOSORT, what are the basic concepts? Here, heart in good shape, mix infections, for example, streptococcus, staphylococcus, pneumococcus, tubercular bacilli, everything is there. Tuberculinum 1M or 2M when there is no other indication. With due attentions, अब यहाँ पर सबसे important बात, the most important thing is that we have to give attentions to the temperature, possible excretions. The dose is allowed to work until effects are no longer observed, 8 days to 8 weeks. During this process, you have a tuberculosis lung, you have a mixed miasmatic state, you have a mixed infections there, your heart is in good shape, you prescribe the tuberculinum when there is no other indications. During this process, we have to give attention to the temperature and excretion. And you have to give time to your remedy about 8 days to 8 weeks. And during this period, you have to give attention to the temperature and excretions. You have to notice the changes. What kind of changes are occurred after giving medicine? Usually a syndrome then present is permitting the accurate choice of antisoric silicea, lycopodium and phosphorus. During this attentive process, we have to find out the anti-miasmatic, anti-soric remedies. It may be a silicea, it may be a lycopodium, it may be a phosphorus. After a while, thus the picture again darken. कुछ टाइम बाद दोबारा से वो सारी चीजें पैदा होगी. After a while, the picture again darkened, and now a high potency of isopathic remedy corresponding to the most virulent and prominent microorganism found in the sputum is given. You guys collect the sputum, go for the bacteriology. Which bacteria is prominent in that particular condition? कौन सा बैक्टीरिया जो है सबसे ज्यादा प्रोमिनेंट है, ये बैक्टीरियोलॉजी बताएगी. This bacteriology will tell you which microorganism is dominating. And you have to find out, it may be a Staphylo, it may be a Strepto, and it may be a Pneumococcinum. That's the time when you prescribe these isopathic remedies. Listen again. You have a case. It may be it is a case of tuberculosis. First is a pyretic condition. Lungs in good shape. Go for a 1M potency. And unless it is very, very necessary, don't go below 1M. Second, your case is with mixed infectious condition. Sputum is mix of different type of microorganism. The heart is always try to judge the condition of the heart during tuberculosis of lungs. Heart is in good shape, go for 1M or 2M potency. If other remedy is not indicated, tuberculinum, 1M or 2M potency. During this period, we have to wait from 8 to 8 weeks. During this process, we have to give attention to the temperature and excretion. And during this process, we have to find out the closest antisoric remedy. It may be silicias, lycopodium, phosphorus, anything. And after a while, the picture again darken. Now a high potency. One thing is consider here, he always says, go for a high potency, Because during this period, we have to prescribe a single dose, but at that single dose should be a keen depth, So can it change the deepest pathology of the patient? Because tuberculosis is not a simple disease, it is a very, very complex condition. Now you go for a bacteriology, and that any particular microorganism which is prominent in that condition give that isopathic remedy. It may be a strepto, it may be a staphylo, it may be a pneumococcus. The accurate bacteriology analysis of the sputum is absolutely essential. Don't prescribe remedy without bacteriological analysis of the case. Without bacteriology analysis of the sputum. Very important, especially in tuberculosis. The choice of the isone again clear the picture. When you prescribe the isopathic remedy, it will open the case. It will clear the picture. And so proceeding on the one-sided etiology, where their isopathica have not yet been proved. On the other side, symptomatologically, with antisoric remedy, the disease is dominant. Tuberculinum to isopathic, the most prominent bacteria, that remedy, and after that it will clear the picture, then go for antisoric remedy. So, Dr. William Boericke says, my own experience warn in case of mixed infection, especially in case of mixed infections against the use of strepto, staphylo or pneumococcinum below 500. Dr. Boericke says, don't prescribe any isopathic remedy below 500. He warned the doctors, don't prescribe low potency, especially in these cases. I use them only in 200, 2000, 2M or 1M potency, having seen terrible aggravation from 30, 100 and 200 with a lowering temperature of 104 to 96. He says, I saw that if you go for a low potencies, they will worse the case. Hence the admonitions which need no concern scoff, but those alone who wish to avail themselves of a potent weapons. अगर पोटेंसी 30, 100 और 200 पोटेंसी में किया जाए तो भयंकर एग्रेवेशन होगी जो टेम्परेचर को इमीडिएटली नीचे ले आएगी. इसलिए यह चेतावनी उनके लिए नहीं है जो इससे मतलब नहीं रखते, परंतु उनके लिए है जो शक्तिशाली हथियार का लाभ उठाना चाहते हैं. If anyone wants to use these weapons, he should understand the special dose, particular dose of the remedy is very, very necessary. The toxin used as a remedies are like tuberculinum prepared from pure and virulent culture. So this is concept of no sword, particularly in case. And if you prepare that no source directly from the patient disease product, it will give you a benefit. So, in cases seemingly condemned, the speed death are brought in a year or two back of normal temperature, though of course sacrificing a large portion of lung tissues. This result is sure when the patient can and will take care of himself, where the heart has withstood the toxin, the stomach and livers are in good function. वो सभी केसेस जो मौत की तरफ तेजी से बढ़ रहे हैं, वो 1 साल या 2 साल में अपनी नॉर्मल टेम्परेचर तक आ जाएंगे, परंतु उन्हें अपनी लंग का कुछ हिस्सा सैक्रिफाइस करना पड़ेगा. And this result is sure when patient can and will take care of himself, where the heart has withstood the toxins and stomach, livers are in good health. So next, on further climatic variation can be avoided. With the great mineral metabolism of the thymus, diet regulation is imperative. Diet is very, very important because the management of this case is much more important than just prescribing the remedy. If you are not managing the case, just prescribing the remedy, you cannot get the results. So management is more important in this case and should be preponderantly vegetables together with the addition of physiological salts in low potencies like calcarea carbon 3x and 5x, calcarea phosphins 2x and 6x, and intercurrently according to the indication organ remedies. Organ remedies. For example, I described a few different type of prescribing a few days before. Different type of prescribing. It may be one of them is organ remedies. That is cactus for heart, chelidonium for liver, taraxacum, Urtica urens, tussilago, lacrimacea tinctures for short periods. The first dose of tuberculinum in any difficult case is, however, the most weighty prescription. सबसे ज्यादा मजबूत भारी प्रिस्क्रिप्शन tuberculinum की होगी. So the remedy should not be given without a most careful cardiac examination. So examination is much important in these cases. Examinations of lung, examinations of the lung tissues, examinations of the liver, examination of the heart. Very important. As the surgeon before the anesthetic, so must the physician know the heart before administering this drug. जैसे कि एनेस्थीसिया देने से पहले हर एक चीज का टेस्ट एक एनेस्थीसिस्ट करता है, उसी तरीके से हमें भी बिफोर प्रिस्क्राइबिंग मेडिसिन हर एक चीज के बारे में पता होना चाहिए. Especially to the children's and seniles and to the young seniles. Children's, seniles, old people, and the people who look old in young age. He who observe this role will have fewer clinical approach on this conscience. When tuberculinum is contraindicated, recourse must be had to the nearest antipsychotics. And the above caution apply also to asthma, pleuritis, peritonitis in sacrophilus subjects. Dr. Niebel. So this is the basic concept what Dr. William Boericke gave us in the treatment of tuberculosis. Tuberculosis, everything, this is a complex condition. We have to understand each and everything. We have to examine the patient. That's why Dr. Hahnemann in his aphorism says, knowledge of the physician is much important than just prescribing the remedy. You should know the physiology. You should know the pathology. You should know the where you can use the surgery, practice of medicine, role of medicine, different type of medicine, miasmatic concept, doses, potencies, repetition of the dose. These are few things every single homeopath should know before prescribing the remedy. This is not a simple thing. This is a complex thing, and we have to understand each and every single step before prescribing the remedy. So this is a small discussion regarding tuberculosis and use of tuberculinum, different type of dose, different type of examination, different type of organ remedies, different type of basic salts, physiological salts, and different type of examination and approach of the physician. Hope so you enjoy this session, and if you have any questions, please ask. We will try to discuss it. And today is the first day of New Year. Keep in touch with books, because these books are the real friends, and try to discuss. Leave your ego in one side. Try to discuss with your friends, with your colleagues, with your seniors, with your juniors. If you have something, give to them. If you don't have something, take from them. But be a good homeopath. Best wishes. Happy New Year. Thank you.